If you empower a woman or a girl, then you've empowered a home, you've empowered a country, and you've empowered the world. From Nurse Damalas in Zambia. No matter what your age, you have the power to make choices that will empower you and impact on the future you want and can have. Empowerment is gaining knowledge and using that knowledge to ensure a better future for you and subsequently a better future for those in your life. One of these choices is a choice regarding safe sex. Avoiding pregnancy will enable you to contribute towards the future of your choice. According to the South African Children's Act 38 of 2005, any child over the age of 12 years of age may seek medical treatment. Therefore, from 12 years of age, you can seek assistance and obtain contraception. Become empowered to make the right choice. Having unprotected sex has consequences that include physical, emotional, and financial implications. Unprotected sex can result in pregnancy and/or getting STDs, which are sexually transmitted diseases, and that includes HIV. Pregnancy is an avoidable consequence of sex. While total abstinence will avoid pregnancy, there are other options that include contraception. If you do fall pregnant, you have major life decisions to make. The first decision is whether to keep the pregnancy or have an abortion. Having an abortion comes with different risks and consequences. Then secondly, if you do decide to keep the pregnancy, the next decision is whether to keep the baby or give the baby up for adoption. Prevention is far easier than the decisions, risks, and consequences you encounter if you fall pregnant. A huge consequence of adolescent pregnancy is the interruption of your education and therefore your future. Legally, you have the right to continue with the schooling, but many schools still insist that you have to leave school. There may be pressure from your family to gain a job to assist with the extra costs of having a child, and it is not easy to study while pregnant and also having a baby to take care of. Pregnancy results in a huge financial burden to both you and your family. There is firstly the cost of having the baby and then the cost of keeping the baby. It is estimated that it costs 7,500 Rand per month to raise a child, and the government grant that you can receive for a child is 440 Rand. A tin of baby formula costs anything from 90 to 250 Rand per tin, and a bag of disposable nappies costs around 300 Rand per 113 nappies. And then you still have to buy the creams, soaps, bedding, and clothes. Giving birth in a government hospital is free, but you have to bring your own supplies. The cost in a private centre starts from around 20,000 Rand. Falling pregnant can result in a loss of friends. They will continue with their school lives, while you have to stay at home looking after the baby or go out to work to assist with the extra added costs. Pregnancy may result in you becoming financially vulnerable and therefore dependent on others for financial assistance, which raises the risk of abuse. Maternal death, which is the death of a woman while pregnant or within 42 days after the end of pregnancy, is higher for adolescents. Adolescent pregnancies account for approximately 10% of births in South Africa, but 45% of maternal deaths during childbirth are adolescents. Alcohol and drugs lower your resistance and you may forget to use a condom. It is always best to ensure that you are taking other forms of contraception and using a condom. Get to know your body and know your monthly period cycle dates. This will help you quickly realize if you are pregnant. Do a pregnancy test as soon as you realize that you are late with your period. This assists with the decision-making process. Pregnancy tests can be obtained from clinics or pharmacies. If you do have unprotected sex or the condom breaks, then inquire about the morning after pill. This pill can be obtained at a pharmacy, clinic, or doctor. Remember, this is not a contraception, but a way to avoid pregnancy in an emergency. An abortion can be done before 13 weeks into the pregnancy in South Africa. After 13 weeks, there are legal issues that need to investigate before an abortion can be done, and the risk to your health is higher. Know that person you are having sex with. This is important should you need to apply for child support and/or do paternity testing if you fall pregnant. You have the right to make choices that protect you and your future. If you are sexually active, make the choice to practice safe sex. It is your right to choose what happens to your body.